Good morning, Chairman. We are ready to begin.
Thank you, Denisha, and welcome to everyone. Denisha, would you please call the roll of board members?
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Russell Crutchfield,
Here.
Cynthia Rucker,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Nelva Lee,
Here.
Shane Mobley,
Here.
Robert Coles.
Here.
Chairman, that concludes my roll call.
Thank you very much. We have 100% participation this morning, and we appreciate all of you joining us. We have an agenda today to work through. Will be, as a board, we will be asked to consider for final adoption vote 4 different items that will be presented to us. To start with, the first thing on the agenda, we'll address the minutes of the previous meeting of September 14th and ask if Dr. Rucker, our secretary, has had a chance to review those minutes and would you recommend approval?
Good morning, Chairman Board. I have reviewed the minutes from September and I've found them to be in order, and I do recommend them for approval.
Thank you. It has been recommended that minutes be approved. Is there a second to that?
Russell Crutchfield will second.
Russell Crutchfield has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? The minutes are approved. Thank you very much. Next item on our agenda, I will turn it over to Commissioner Carlson for the Commissioner's report.
Thank you, Mr. Chairman and members of the board, and a good morning to all of you viewing today virtually. It's been a busy time here at DCH since we last met on the 22nd of November. Our team, in concert with our friends and colleagues at the Department of Administrative Services, released the long-awaited RFP for the next round of Medicaid managed care contracts. In addition to being the state's largest procurement, we feel it's the state's largest health policy document, and we're very proud of the work that's gone into that. I want to personally thank the numerous clinical, legal, procurement team members for their countless hours into this effort. A lot of breakfast, lunch, and dinner at their desks, a lot of weekend duty. And as we all know, this is the beginning of the process, not the end, but we are very proud of the work that's gone out. Look forward to discussions in the future. In fact, in this very room on the 29th of September, we held the bidders conference for that project, and we'll have numerous question and answer sessions moving forward throughout the month of October. And we'll begin the long work ahead of evaluating these proposals in the months ahead. The team continues to spend countless hours with both CMS and our state partners on the Medicaid redetermination exercise going on across all states and territories. This is an evolving process. There are endless systems and policy changes, but we continue to seek and respond to public input. We continue to work with our CMS partners on technical assistance, always trying to improve the process and always trying to improve the experience for our Georgia families during what can be a challenging time for some. But we're proud of the work that's gone into that, not only at DCH, but our state partners affected also. I want to congratulate our finance and policy teams on the approval of several directed payment programs that were approved by CMS over the past months as we were last here. Again, a lot of work and preparation, a lot of creativity, and hopefully this is a resource that will continue to serve hospitals and other providers well as they continue to move forward with their mission. Shifting to the state health benefit plan, I want to thank Louis Amos and his team for their preparation with open enrollment and the numerous rounds of public meetings throughout the state and virtual fairs conducted simultaneous to that. In fact, earlier this week, they've already had, by my count, 2 separate meetings of over 200 attendees. So there's a lot of interest out there and we're appreciative for that. So I encourage all state employees and all partners out there to be mindful of the October 16th start date of open enrollment. Take a look at your existing plan, take a look at your your decision guides as you prepare your family for the next round of enrollment and the benefits package that you feel is the best fit for you in 2024. And always reach out to our team should you need assistance, conversation, dialogue, and a deeper dive into your options. As we know, the legislative session is practically upon us, and in just the weeks ahead, our team will have presented to both the House and Senate on topics ranging from certificate of need to the state of rural health care in our state, not to mention the numerous financing and policy options that will be before us in the months ahead. We're very grateful for the partnership that we have with the legislature and want to continue that open dialogue on new ideas moving forward. And your agency, your Medicaid agency will continue to be open to all ideas and be in a position to hopefully respond to any policies that come out of the session before us. As for today, we have 4 items up for final adoption, several of which pertain to the priorities that the governor and legislature have placed upon us pertaining to behavioral health, an opportunity to hopefully pursue new options for the public and improve existing options. And there's one new thing I like to do, Mr. Chairman. It is the custom for us to recognize milestones here at the agency. And we will again do that. But in addition to saying thank you to our 5, 10, 25, 30 year public servants, Kelly Washington and our HR director and myself, after taking some input from our colleagues here at DCH, decided that it's high time we started just saying thank you to the people that are celebrating their first year at DCH. In this workforce challenging environment that we have before us, you can never take someone's service for granted, and it's never too early or too late to thank those who have made DCH their home, made DCH hopefully their family, and hopefully this first year is just the first of many milestones before us. So at this time, Mr. Chairman, I'd like to thank R12 Blue and the Office of Inspector General for 1 year, Sarah Buffington and the Office of Inspector General for 1 year, Cheryl Davis, also the Office of Inspector General for 1 year, Tracy Renee Ballard and the Georgia Composite Medical Board for 1 year, Brittany Norwood, also at the Georgia Composite Medical Board for 1 year, Barbara Marie Kallmeyer and the Division of Fiscal Management for 1 year, Shanae Owens and the Division of, Financial Management for 1 year, Jamaica Mitchell, Office of Information Technology for 1 year, Renee Cobb at HFRD for 1 year, Emily Lobeck and the Georgia Drugs and Narcotics Agency for 1 year. Then moving to our 5-year celebrations, Yolanda Guthrie at HFRD for 5 years, Deborah Joyner in the Commissioner's Office for 5 years. Thank you, Deborah. Eva Angela Smith, the Georgia Composite Medical Board for 10 years, Carolyn Porter for 10 years, Maria Poland Schaffler, HFRD for 10 years, Douglas Tatum, Office of Information Technology for 10 years, Nazia Akadea for 15 years, and Kelly Floyd in MAP for 25 years. So thank you all for your selfless service to the state and to your fellow citizens. And it's an honor to celebrate you this morning. And at this point, Mr. Chairman, I'll hand it back to you for the agenda. Thank you.
Thank you, Commissioner. Are there any questions or comments for the Commissioner from the board, please? Hearing none, we will move into the agenda. And the first item, actually the first 2 items that we'll be asked to consider for final adoption will be presented by Brian Dowd, Deputy Executive Director, Policy and Compliance and Operations. So Brian, would you please proceed?
Thank you, Mr. Chairman, Commissioner, and members of the board. First, I'm presenting for final adoption a rate methodology change for psychiatric residential treatment facilities. At the September board meeting, the Department of Community Health proposed pending CMS approval to adjust fee-for-service rates for psychiatric residential treatment facilities effective September 15th, 2023. Rate for PRTFs will be adjusted to 75% of the 2023 Medicare inpatient facility rates. At the September board meeting, we indicated that the rate methodology would be based on 2022 Medicare inpatient facility rates. We did correct that and send out a revised board notice prior to a revised public notice prior to the public hearing we held. That change in year did not affect the rates for any individual psychiatric residential treatment facility, nor did it impact the overall fiscal analysis. It was simply an error in putting 2022 rather than 2023, which we should have done. It was actually my error. I put 2022 instead of 2023. So we did correct that for submission to CMS and for full transparency that we are using the 2023 Medicare inpatient facility rates. An opportunity for public comment on the proposed change was held September 20th, 2023 at 11 a.m. via Zoom, and written comments were able to be submitted on the proposed change on or before September 27th, 2023. DCH received no oral comments. We received one written comment from Carrie Connolly, the General Counsel and Executive Vice President of the Georgia Hospital Association. The Georgia Hospital Association and its 145 members supported the change in rate methodology for PRTFs. They believe that it would increase access to behavioral health service and thank the board and DCH for this change and consideration of the change. In response, DCH would like to thank Ms. Connolly and the Georgia Hospital Association for their written comment and support. If there are any questions, I would be happy to answer them at this time and would respectfully request your final adoption of the rate methodology change for psychiatric residential treatment facilities.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Chair Mobley motions.
I'm sorry,
I'll
who
second.
made that motion?
Shane Mobley.
Oh, Shane Mobley has
Yes, sir.
moved to, for final adoption approval. Is there a second?
Dr. Meek seconds.
Motion has been made for approval and seconded. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much, and you may proceed to your next item. Thank you.
Thank you. I am also presenting for final adoption an update to the Medicaid and Peach Care for Kids coverage package to allow for biomarker testing coverage. At that September board meeting, the Department of Community Health proposed to update the Medicaid and Peach Care for Kids coverage package to allow for biomarker testing as medically necessary. Effective date for the change will be September 15th, 2023. Biomarker testing means the analysis of a patient's tissue, blood, or other biospecimen for the presence of an indicator of normal biological processes, pathogenic processes, or responses to specific therapeutic interventions in genes. DCH will initially open current procedural terminology codes 0037U, 0239U, 0172U, and 0345U for coverage, but we'll consider other coverage types as they are presented to us. All biomarker testing codes will be open at 80% of the third quarter 2023 clinical diagnostic laboratory fee schedule. An opportunity for public comment on the proposed change was held September 21st, 2023 at 12:30 PM via Zoom audio. Written comments were able to be submitted on or before September 28th, 2023. No oral comments were received by DCH. 7 written comments were received. They were from Christina Ozilis, the Director of Nursing Services from Peachtree Wellness Solutions, Anthony Hall, the owner of Ascension Psychiatric Services, Dr. Hood Aline, for a double board certified adult, child, and adolescent psychiatrist, Candace Lewis, a physician assistant from Village Medical, Ivan Chatterley, the associate regional account manager from Myriad Genetics, Lisa Rudolph Watson, the medical director and doctor from Georgia Pines Community Service Board, and Brennan Camo, the clinical director from Bio Wellness. All the commenters thanked the board and DCH for consideration of coverage of biomarker testing. 6 of the 7 commenters noted coverage of GeneSight, one of the codes we're covering, 0345U specifically, and talked about the benefits related to mental health treatment by covering that code. DCH would like to thank the commenters for their written response and their support. If there are any questions, I would be happy to answer them at this time and respectfully request final adoption of the coverage of biomarker testing.
Are there questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Roger Folsom, motion for final adoption, Mr. Chairman.
Roger Folsom has made motion for final adoption. Is there a second?
Cynthia Rucker, second.
Dr. Ruckers has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, and thank you very much, Brian, for all your work. And I know there's a lot of background work that went into this, and we thank you for providing us all the detailed information that we could review in advance. Thank you.
Thank you, sir.
Next item on the agenda that we'll be asked to consider for final adoption will be presented by Lynette Rhodes, Chief Health Policy Officer.
Good morning, Chairman. Good morning, Commissioner and board members. During the September board meeting, we requested initial adoption and approval from the board to establish certified community behavioral health center services effective July the 1st of 2024. Just as a reminder, CCBHC services include a comprehensive and integrated package of mental health and substance use disorder services and supports. We will reimburse previously individually billed outpatient behavioral health services on a daily per diem basis going forward once established. All of the certified community health behavioral health center providers will be required to be certified by the Georgia Department of Behavioral Health and Developmental Disabilities. And as a reminder, the state will reimburse these providers using a provider-specific daily payment rate. And so this rate represents the cost of providing services, all CCHB services on a daily basis. Payment will be limited to 1 payment per day per CCBHC per beneficiary. An opportunity for public comment was held on September the 20th at 12:30 p.m. via Zoom. Written comments were due on or before September the 27th. We did not receive any oral comments. We did receive 16 written comments from the following individuals: Carrie Conley, General Counsel and Executive Vice President of Healthcare Policy for the Georgia Hospital Association; Tamara Collin, Chief Executive Officer for Advantage Behavioral Health Systems; Denise Forbes, Chief Executive Officer for Community Service Board of Middle Georgia; Marcus Garner, the Chief Executive Officer for Athens Neighborhood Health Center; Robin Garrett, the Executive Director for the Georgia Association of Community Service Boards; Dana Glass, the Executive Director of Aspire Behavioral Health and Developmental Disability Services. This is the Albany Area Community Service Board. Jennifer Henderson, the Program Director for Bright Paths. Tiffany Henderson, the Chief Executive Officer for Unison Behavioral Health. Jennifer Hibbard, the Chief Executive Officer of Viewpoint Health. Sally Kimmel Shepherd, the Executive Director of Envision Athens Incorporated. Fisher Lee, the Education and Outreach Coordinator of Southern Healthcare Collaboration, Inc. Nicole Lee, the Chief Executive Officer for Southern Healthcare Collaboration, Inc. Lindsay McCoy, the Director of Pharmacy for the Village Drug Shop at Advantage. Sheriff Janice Mangum, who is the Sheriff of the Jackson County Sheriff's Office. Heather Rossner, who serves as the Chief Executive Officer of Bridge Health. And Jason Smith, the Chief Operating Officer of Piedmont Athens Regional Medical Center. All commenters were in full support of the proposed change, as it will increase access to quality behavioral health care services for the citizens of Georgia. The commenters indicated that the CCBHC model will result in a comprehensive community-based delivery system that focuses on whole health, which includes physical health needs, crisis care, and coordinated care. The commenters further noted that this model will assist in stabilizing the financially stressed community service board network and enable the community service boards to recruit and retain the workforce needed for an effective public behavioral health safety net. Further, the commenters expressed their gratitude and acknowledged the impactful collaborative efforts of DBHDD and DCH in their efforts to transform Georgia's public safety net for behavioral health. In closing, we request final adoption.
Thank you very much, Lynette. Are there questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Motion for approval, Cynthia Rucker.
Dr. Ruckers has made the motion for final adoption. Is there a second?
Russell Crutchfield will second.
Russell Crutchfield has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining?
Abstaining, David Cruz.
David Cruz has abstained from the vote. Put that in the minutes. Thank you very much. And Lynette, it is approved. Thank you.
Thank you.
Next on the agenda, and the final item for consideration for final adoption will be presented by Brian Lipton, Director of Strategic Finance. Brian, please.
Good morning, Mr. Chairman, members of the board, Commissioner. Thank you for your time this morning. Today, I'm presenting for final adoption a proposal to rebase the Georgia Medicaid Inpatient Prospective Payment System, IPPS, from TRICARE Diagnosis-Related Grouper, TRICARE DRG, to the All Patients Refined Diagnosis-Related Grouper, also known as APR DRG, effective January 1st, 2024, pending approval by the Centers for Medicare and Medicaid Services. The cost impact is budget neutral, resulting in no additional federal or state dollars. While there is no overall budget increase, there may be fiscal impact to individual hospitals. To mitigate the fiscal impact of individual hospitals, DCH will include a stop gain, stop loss factor. The DRG weights used in the base rate calculation will change in accordance with the new grouper. APR DRG is applicable to all patient populations, including obstetrics, newborns, and pediatrics. TRICARE DRG was developed for the Department of Defense and adapted for Medicare and Medicaid hospital reimbursement. Currently, Georgia is the only state still reimbursing hospitals using the TRICARE DRG. The hospital's statewide base rate will change from $5,310.99 to $5,985.86. The statewide base rate was last updated in 2019. The formulas for the hospital base rate payment will remain the same, and the department will continue to include the 4 components that can change the statewide base rate to a hospital-specific base rate. Those 4 components are pediatric specialty hospitals, the Medicaid inpatient utilization rate, inpatient medical education, and the stop gain, stop loss factor that we mentioned previously. An opportunity for public comment was held on September 18th, 2023 at 1 p.m. No oral comments were received. The department received 1 written comment from Carrie Summers, Chief Financial Officer and Executive Vice President of the Georgia Hospital Association. Ms. Summers appreciates the department's ongoing transparency and collaboration with GHA to prepare hospitals for the transition and is supportive of the department's application of an individual hospital stop loss. The department thanks Ms. Summers for her comments and GHA for their support. At this time, I would respectfully ask for the board's favorable consideration for the final adoption of the transition from TRICARE DRG to APR DRG effective January 1st, 2024. Thank you, and I'll pause for any questions.
Are there any questions, comments for Brian from the board, please? Hearing none, is there a motion for approval for final adoption?
This is Dr. Lee. I motion for approval.
The motion's been made for approval for final adoption. Is there a second?
Roger
Second.
Folsom, second, Mr. Chairman.
Folsom has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved, Brian. Thank you very much.
Thank you.
That concludes the items for consideration for final adoption. Again, we thank the department for the work and that went on behind the scenes to prepare for today's presentations and providing us the detail of that so we could consider in advance. With that, I will ask if there's any new business or closing comments that need to come before the board at this time.
Well, Chairman,
Commissioner?
I would just like to thank all the different stakeholders, constituency groups for the amount of participation in the process. There was a lot of comment, written and oral, for this meeting cycle, and I'm appreciative of everyone's involvement and helping us with the feedback. So thank you all for being active participants in what we do.
Thank you, Commissioner. Any other comments from the board at all, as we close? Hearing none, the meeting will be adjourned. Our next meeting will be in this location on November 9 at 10:30. Thank you so much, and thank you for joining us. Have a good day.
Thank you.
Thank you.